Hello to all students. In this video lecture, we are going to discuss liver function tests. Liver function tests are also known as liver panels. These are specialized blood tests which are performed to detect any infection, damage or problem in your liver or to determine or diagnose an infection or illness or a disease in your body. So what are the most important symptoms which leads towards these tests? So doctor advise LFTs on the basis of the symptoms of the patient. So most important symptoms are jaundice, yellowing of skin and yellowing of white eyeballs, nausea and vomiting, which is important symptom of hepatitis and gastrointestinal infections, diarrhea, abdominal pain, dark colored urine, light colored stool and fatigue. These are the most important symptoms which leads you towards liver function test. But at the same time, why do we need LFTs? Why do we have to do liver function tests? So it is done to screen for liver infection. Doctor wants to know that is there any infection like hepatitis A, hepatitis B or C or any other kind of infection like typhoid fever or any gastrointestinal infection in your body. Monitor our disease. During disease, our liver is badly affected because certain type of enzymes are produced and the drugs and the medicines has effect on the body of the patient. So we have to monitor what's going on in the liver during a certain disease. Look for signs of serious disease. With the help of these LFTs, we can determine what kind of disease is going on in the body and monitor side effects of medicine because certain medication has very serious side effects if taken in higher doses or taken in a long run, and they can damage the liver. So doctor decides to take LFTs to check whether these medications are working or not, or if the disease is progressing or regressing. So there are certain enzymes which are produced inside the liver and which are determined by these tests. So number one, alanine transaminase ALT. It is also known as SGPT. It is an enzyme that converts protein into energy for liver cells. Its normal value is 7 to 55 unit per liter. And higher level more than 55 or 56 unit per liter of this enzyme in the bloodstream. It is a sign of serious infection or liver damage. So when liver is damaged, ALT levels increases in our blood. So that is a sign of certain disease or liver damage. The second test is alkaline phosphatase, ALP. It is also an enzyme which is found in liver and bones. Higher levels of ALP means there is a certain infection like typhoid, gastrointestinal infection or liver damage. The normal value is 40 to 129 unit per liter. Higher than this value is a sign of infection or liver damage. The next test is albumin and total proteins. Albumin is a very important protein which is present in blood serum. It helps to regulate blood pressure and also have some other functions. There are some other proteins which are also found in our liver. So these proteins are very important for the defensive mechanism of the body. So these proteins fight infection in our body. If there is an infection due to some viruses, bacteria or some other organism, the the level of these protein decreases in the body, which is a sign of liver damage or some important or serious illness. So the normal range of albumin is 3.5 to 5 gram per deciliter, and other proteins, total proteins 6.3 to 7.9 gram per deciliter. So if the amount of these proteins is lower in the blood, it is a sign of liver damage or any gastrointestinal infection or kidney infection. The next test is bilirubin. Bilirubin, as you know that the age of our red blood cell is only 4 months. After 120 days or 4 months, they die. These dead cells are transported to liver, where they are broken and recycled. During recycling of red blood cell, a chemical substance is produced which is known as bilirubin. If the bilirubin increases in our blood, it is a sign of liver damage. So bilirubin is a breakdown product of red blood cells. The normal value is 0.1 to 1.2 milligram per deciliter, and its higher levels means there is a damage in the liver. The next enzyme is gamma glutamyl transferase. Gamma glutamyl transferase, GGT. This enzyme is present in our blood, and its higher levels is a sign of liver damage or damage in the bile duct or blockage in the bile duct. The normal value is 8 to 85 unit per liter. More than that is a sign of infection or a disease. L-lactate dehydrogenase, which is also known as LD, it is also an enzyme of liver. Its higher levels is a sign of liver damage. The normal value is 122 to 222 unit per liter. Prothrombin time. Prothrombin is a protein which helps our blood to clot, and there is a certain time which is taken by our blood to clot. If that time increases, it means there is a problem in the liver. It is a time it takes your blood to clot, and normal value is 9.4 to 12.5 per second, and if this value is higher than these levels, then there is a liver damage. One more important test which include LFTs is aspartate transaminase, which is also known as AST. It is also known as SGOT. It is an enzyme that helps our body to break down amino acids. As you know that amino acids are the end products of proteins, and higher levels of this enzyme in our body or in our blood is a sign of liver disease or muscle damage, and the normal value is 0 to 35 unit per liter. So depending upon these values of your liver function test, a doctor can diagnose a certain infection, a disease or condition of your liver, which helps to treat that infection or disease or to manage or to save your liver, because liver is a vital organ and gland in your body, and its proper functioning is very necessary for your health. So take care and see you in the next lecture.